Welcome to my another video. Today we discuss about most important MCQ on community health nursing for any nursing competitive exams. For more important MCQ on nursing subjects, make sure you subscribe to this channel. First question is, in demographic stages, when birth rate begins to decline and death rate further decreases is called Option A, high stationary stage, B, early expansion stage, C, late expansion stage, and D, low stationary stage. Right answer is option C, late expansion stage. There are total 5 stages of demographic cycle. First stage, also known as high stationary stage. In this, birth rate is high and death rate is also high. That will cancel each other and the population remains stationary. Second stage is also known as early expansion stage. In this stage, death rate begins to decline and birth rate remains same. Third stage, also known as late expansion stage. In this, the death rate decreases still further and birth rate display as fall. Fourth stage is also known as low stationary stage. In this, the birth rate is low and death rate is also low. This results population becomes stationary. Fifth stage is also known as declining stage. In this stage, birth rate is decreasing than the death rate and population is declining. Next question is, entomology is the science that studies option A, behavior of human beings, B, insects, C, behavior of ants, D, formation of rocks. Right answer is option B, insects. Next question. Philosophy of primary health care are as follows except option A, equity and justice, B, intersectoral approach, C, primary prevention, D, interrelationship of health and development. Right answer is option C, primary prevention. Philosophy of primary health care is mainly based on values of equity, social justice, solidarity, intersectoral approach, and interrelationship of health and development. Next question. Which of the following is not a content of drug kit A provided at subcenter? Option A, oral rehydration salt, B, tablet cotrimoxazole, C, tablet paracetamol, D, vitamin A solution. Right answer is option C, tablet paracetamol. Drug kit A at subcenter includes ORS, iron and folic acid tablets, vitamin A solution, and tablet cotrimoxazole for pediatric use. Next question. Secondary prevention is option A, safe water supply, vector and reservoir control, B, early diagnosis of disease and prompt treatment, C, good living and working condition, D, nutritional counseling. Right answer is option B, early diagnosis of disease and prompt treatment. Secondary prevention mainly aims to reduce the impact of a disease that has already occurred. This is done by detecting and promptly treating the disease or injury as soon as possible to slow its progress. Next question is, population covered by a subcenter in hilly area is option A, 5,000 population, B, 3,000 population, C, 10,000 population, D. 30,000 population. Right answer is option B. 3,000 population. Subcenter is a peripheral area of village having healthcare delivery system and it works at grassroots level. One subcenter covers 5,000 population in plain area and 3,000 population in hilly and tribal areas. Next question is, what is the best method to dispose hospital waste? Option A. Composting. B. Dumping. C. Chemical treatment. D. Incineration. Right answer is option D. Incineration. Next question. Residual chlorine after chlorination of water should be option A. 1 mg per liter after 1 hour. Option B. 1 mg per liter after half an hour. C. 0.5 mg per liter after 1 hour. And option D. 0.5 mg per liter after half an hour. Right answer is option C. 0.5 mg per liter after 1 hour. Next question. Guthrie test is useful for screening. Option A. Jaundice. B. Phenylketonuria. C. Thalassemia. D. Hemophilia. Right answer is option B. Phenylketonuria. Guthrie test is a simple screening blood test for phenylketonuria. Next question is, amino acid deficient in wheat is option A. Leucine. B. methionine. C. lysine. D. cysteine. Right answer is option C. lysine. Lysine is an amino acid found in beans, cheese, yogurt, meat, milk and other animal proteins. Next question. Best indicator of fertility is option A. GER, general fertility rate. B. TER, total fertility rate. C. CBR, crude birth rate. D. NRR, net reproductive rate. Right answer is option D. net reproductive rate. Next question. Still birth rate includes fetus dies after option A. 20 weeks. B. 24 weeks. C. 28 weeks. D. 32 weeks. Right answer is option C. 28 weeks. Next question. The best time for insertion of IUCD in women is option A. within first week of cessation of menstrual period. B. 14 days after menstrual period. C. 1 week before menstrual period. D. during menstrual period. Right answer is option A. within first week of cessation of menstrual period. The IUCD insertion is scheduled within 7 to 10 days starting of menstrual period because internal os is slightly open during the first 7 days of periods. Thereafter the os closes and makes the copper T insertion difficult. Next question. A newly married healthy couple is asking for the best method of contraception and which of the following method a nurse will advise? Option A, barrier method. B, redeem method. C, intrauterine devices. D, combined oral pills. Right answer is option D, combined oral pills, because it has very low failure rate and a lot of contraceptive benefits. So it is a preferred option for newly married healthy couple. Other options like barrier method has high failure rate, redeem method is unreliable, and intrauterine device is not a first choice for young and never pregnant women. Next question. Which of the following is an activity of under 5 clinics? Option A, midday meal program. B, child education. C, growth monitoring. D, school health services. Right answer is option C, growth monitoring. Next question. Which day is celebrated as Labor Day? Option A, 1st June. B, 7th April. C, 1st May. D, none of the above. Right answer is option C, 1st May. Next question. The procedure of quarantine was introduced to protect against importation of option A, yellow fever. B, cholera. C, leprosy. D, plague. Right answer is option D, plague. Next question. Causative agent of mumps is option A, Bordetella. B, paramyxovirus. C, Toga virus. D, Haemophilus influenza. Right answer is option B, paramyxovirus. Next question. Drug of choice for leprosy is option A, paracetamol. B, Depson. C, streptomycin. D, ivermectin. Right answer is option B, Depson. Next question. Tuberculin test denotes option A, previous or present sensitivity to tubercle proteins. B, patient is resistant to tuberculosis. C, patient is susceptible to tuberculosis. D, protective immune status of individual against tuberculosis. Right answer is option A, previous or present sensitivity to tuberculosis. Tuberculin test or purified protein derivative skin test is a test that determines if you suffer from tuberculosis. Tuberculosis is a serious infection, usually of the lungs, caused by the bacteria Mycobacterium tuberculosis. So this is the today's video. Thank you for watching my video.